Welcome to Direct Primary Care Benefits Podcast, your resource to understanding how DPC and the direct care model is fixing healthcare for employers and individuals alike. Learn from the most innovative and disruptive business executives, brokers, physicians, and healthcare influencers that are in the trenches, changing the way employee benefits are being administered across the country. I'm your host, Brett Shoemaker. Well, welcome everybody to Direct Primary Care Benefits Podcast, episode number 9. This is Brett Shoemaker, your host, and I am super excited today because we have a special guest all the way in from Utah, Miss Heather Eden from Zion Healthshare. Heather, why don't you tell the audience hello this morning?
Good morning, everybody. I'm so excited to be here and help with this podcast with Brett Shoemaker and Simply Direct Primary Care. Thanks for having me on today.
Absolutely. Well, listen, I want to just preface our conversation here today, and our podcast talks to primarily healthcare brokers and employers. And essentially what we do is educate them on the direct care model and how direct primary care and other assets and utilities can work to help build a phenomenal health plan. And for those of you that don't know, Zion Healthshare is an amazing healthshare platform that started in Utah. And Heather, I don't want to take away your thunder here. So why don't you tell everybody a little bit about Zion Healthcare, when they started, how they started, and then we'll dive into some of the details.
Absolutely. Zion Healthshare was created about 4 years ago in an effort to, offer something different. The creators of Zion Healthshare had worked with previous Healthshares before and kind of seen, that they are such a good opportunity, but there were still some things in nuts and bolts that were just still preventing, access to care and just kind of still hindering the process somewhat. And so what they did was broke it down, took down all the barriers and opened it up to everyone. So Zion Healthshare is available to everyone. Everyone is welcome to join us. It's really easy to use us. We're also one of the fastest paying health shares out there. Our turnaround time on paid bills is about 2 weeks currently. We keep growing at a steady rate. We keep experiencing little spurts of growth, and we're capping out at about 40,000 members as of today, which is in 2022. Our mission is to change healthcare together and offer a higher level of care. When you call into our member care service, our member care team knows who you are. You don't have to get bounced around from agent to agent. They're going to help you with that accessibility. Like I said, it's open. We don't have a network. You can use any provider that you want to, which really gives freedom to really go out and get your health care and not have to be dictated by another entity, if you will.
Well, first of all, I love what you said. You said our mission is to change healthcare, and that is exactly why this podcast exists. I sign off every single podcast episode, Heather, and thank everybody for helping us fix healthcare. So I love what you said there. And, here's the thing, right? 40,000 members. First of all, congratulations. I know you've got to be excited every day when you come into work knowing that you guys are changing healthcare and you're 40,000 members strong, huh?
It does. It gives a good reason to come to work today. It's important to me. I've been in the healthcare field for many years, and I get to do something that makes a difference and, just gives that warm-hearted feeling, just like direct primary care. Direct primary care is out there just to give healthcare to people.
Well, I want to dive into some of the assets of Zion Healthshare, but you just said something that I want to dive into a little deeper there. You said you've been in healthcare for a while. Why don't you give our audience a little bit of context and background as to what your experience is in healthcare?
So my bulk of my experience comes from pharmacy. So I was a pharmacy technician in retail and long-term care for quite a number of years. And then I've also had some spaces and places, internships and what have you with cardiac rehab and exercise space. I'm also a certified personal trainer. So just good health has always been important to me. And I got to see, how the insurance system will dictate a person's health care in the pharmacy system. It was just disheartening to have to tell a patient that they couldn't have the medication that them and their provider had sat down and decided was the best route for them because of XYZ factors from the insurance company, which had nothing to do with their actual health care. And I remember that moment, and I just said, this is really not healthcare, is it? And so when I got to be a part of an organization that makes a difference and gives access to care, and it is about healthcare, I was all on board.
I love it. Well, I appreciate that little context there. So for everybody listening, a Healthshare is basically a utility that helps you cover all of your catastrophic needs, not only catastrophic, but even some of your specialty visits. There's a lot of things that they cover, whether you have a direct primary care physician or not. There's plans that kind of help you customize your care. And what I want to just share with everybody out there, and I'd love to hear, Heather, here in just a second, your definition of what a health share is. But Zion, as she mentioned, covers everybody, right? Or can take care of everybody. And whether you're an individual or a family, whether you're an employer or you are a DPC member, I love how your website, Heather, is divided into those three categories, because that is exactly, all of the buckets, as far as I'm concerned, that they fit into. So how would you, for our listeners out there, right? Because remember, we're talking to employers, and sometimes employers, when they're moving away from that fully insured model, they can be kind of scared and say, man, what is this health share thing? What is this medical cost sharing business all about? So how would you define it, and how would you explain it specifically to employers that are out there that are maybe a little apprehensive, but they're looking to do something different and they really want to do something that their employees can value? How would you define it?
Absolutely. And I apologize for not giving a bigger definition earlier, but here's my opportunity. A health share is an alternative, like you said, to an insurance product. Think of it, if you will, as comparing maybe to a catastrophic insurance. Most of us have had a catastrophic plan. We have a high deductible to pay to meet until we meet that, and then the plan won't pay anything. So we're basically self-pay consumers anyway up until that point. For a health share, we are a community of people who come together and share in each other's medical needs. So just like an insurance, in a way, you would have a monthly contribution, but it's far less. You're going to experience about 30 to 40% less of what you would on an insurance plan for your monthly premium or for your monthly contributions. That money goes into a pool of funds, and when anyone in that pool has an eligible medical need, then that money is pulled out and shared in directly to the providers. So it's just that good-hearted feeling of people coming together and helping each other out. It does have its roots in Christianity. It did start with a Christian group some years ago, but as we evolve, as we see it be such a good opportunity, it's now we're open to everyone. So when I say that we don't require our members to be part of any particular religion, you can come to us just as you are. Excuse me. And for an employer, like I said, you're going to see that savings of about 30 to 40%, especially on the employer contribution side. And what we usually see is it paired with a direct primary care. Your direct primary care is going to be there for your everyday needs, for your chronic conditions, and for your employees. They have somebody they can go to for the small things, which means it's going to keep them in the workplace more often and prevent those bigger things. And if you do have the bigger things, then Zion Health is that companion, that other puzzle piece, if you need to use us. So we're a little bit of a different model. A question that comes up quite often is how do you share in pre-existing conditions? And that's where we do have a little bit of limitations, and you'll see that with us. But anyone can still join us with pre-existing conditions. It just has to make sense, and we really advocate for those phone calls so we can have those conversations. But what that does is it answers that question. A lot of us are families. We have a high deductible plan. We're paying out of pocket anyway. We're paying our mortgage payment and our insurance payment, and they're about the same. And what Zion Health does is gives lower costs, so more money can go back into your pocket. It also teaches you that you can shop for your health care. You're not necessarily dictated by any one particular system. You can go out and see the provider that you would like. It's just a really good opportunity. We most often see employers fully contribute their health share monthly portion and the direct primary care because they're still saving 40 to 50% less of what they were looking at on a traditional plan. And that is really important for those employers that are under 50 or, full-time employees. Now that gives them an opportunity to be competitive and to offer something, to their prospective new hires and really get them, competitive in that marketplace where it's been a little bit tough these last couple of years.
Yeah, absolutely. And you know what? It's so awesome that you said a few things here. I made a couple notes, but I listened to a presentation. There was a gentleman that came into health underwriters training class that I was at yesterday, and he was talking about, healthcare is the only, item that when people consume it, they have no idea what the pricing is, right? You just kind of get the EOB at the end and you're wondering what in the world are all these bills, right? And so what I love about Zion Health and what you'll find about Healthshares is this is the question that I want you to think about, employers and brokers that are out there. What insurance company out there has all of their rates, all of their premiums, whatever you want to call it, the pricing is transparent. It's on the website, right? These insurance companies don't do that. You don't know what the amounts are, as Heather mentioned. And when she talks about shoppable, items or shoppable surgeries and shoppable events that you need in relation to your healthcare, there's a company that Zion has partnered with that we've had on the show here and talked to, but Savos Health. And I got to tell you, Heather, I don't know how you feel about Savos. I know obviously you guys are partnered with them and do a lot of great things, but man, can we talk a little bit about Savos? Because I think what Savos is doing is an absolute game changer and is such a great augment to what you guys deliver.
Absolutely. And I'm so glad that you went there because I was hoping we'd get to touch on that. Savos Health, I know these guys personally, fantastic people in person, so fun to talk to, really on their game. Met them at the HINT conference in person finally. We built this virtual relationship right through COVID, then we finally get to meet in person. It's hugs all around and just great people. But what they've been doing is that same thing that you talked about, is that transparency pricing. And you'll find, the movers and shakers in this space, like direct primary care, like Savos Health, like Zion Health, that are looking to change healthcare. They're transparent with their pricing. I mean, even your Oklahoma Surgery Center, they started that wave, right, where they're open with their pricing. They cost a lot less and they have a package deal and they're open with it. It's all printed on their website. So what Savos Health does and what we've done is to partner with them is, like I said, we have that kind of white glove service with our members. We know who you are when you call. If you have an upcoming procedure or surgery, we're going to help you find a physician or a surgeon if you don't already have one. And Savos Health is part of that puzzle. So we utilize their services. They're going out and gathering, all of this information. They're partnering with these places, these standalone surgical centers, these high quality but low cost facilities where they take out the middleman and just offer health care. And they're putting those all together, and we get to utilize their services to help our members find those. It's a win-win-win for everybody. We're all changing healthcare together, and I'm just a super big fan of Savos Health. I think they do a really great job.
Absolutely. Yeah. Lou and Ryan, and to have a family business and work with your dad, I think that's so cool. I always tell my dad all the time, like my dad has several investment properties, and I always tell him, I'm like, Dad, could we buy an investment property and just do it together? But he's, he just turned 65 and he's like, man, Brett, I'm just kind of on the, relaxing time. I just want to spend my time in my Colorado house and just do nothing. So maybe one day I can talk him into it. But I think that's so cool that Ryan and Lou get to work together every day, right?
Absolutely. Fantastic people in person, full of energy, really on their game.
Yeah, absolutely. So Heather, let me ask you, do you have any kiddos? Mary, what's your personal life look like, if you don't mind me asking?
Hey, those were some personal questions. No, I am divorced 7 years. I have 4 kiddos. And they're growing up faster than I can stop them. So most of them are into adults, and I have a little guy still at home that's 11.
You have adults? You have adults? We were on a video call, and you look like me, right? You're like, I get that all the time. So my oldest, I'm 39 years old for any of the listeners that are wondering, but I have an 18-year-old who's a senior in high school, and everybody always says, you have an 18-year-old? So I'm going to say the same thing to you. How old are your kids? Because you look like you're, 30, 32, 31, 29.
Oh, wow. Aren't you sweet? My oldest is 21. So, and then we've got them spread out in between down till 11. So, same thing. I don't know if it's you. It's just active lifestyle. It's keeping healthy, good genes, knock on wood, to keep me going. So,
yeah, like my wife always says, good moisturizer, right?
That too.
Well, listen, let me ask you. So what do you see? I always like to ask this question to everybody that get on the show here, but what do you see the future of healthcare? Because what I see, right, I want to kind of lead you in this direction if I can, but I see that we are moving in this direction of health shares and non-insurance products for healthcare. And I know that there's a lot of regulators out there in the quote unquote healthcare cartel that tries to keep everything the same and get these kickbacks and whatnot. But I personally think that it is inevitable that the tide is changing, and insurance companies and entities that are not transparent are going to be forced to consume healthcare or allow consumers to consume healthcare with this transparency model. So what is your vision for the future? What do you think healthcare is going to do as we move forward?
Oh, absolutely. And I always say, just let people keep doing what they're doing. If you keep letting the insurance companies and the entities that decide those, the way that things are going, you just let them keep operating the way that they are, it will keep moving the way that it is. I don't know about you. So if I've had experiences with insurance companies where I felt like they should pay me. I'm calling the doctor. I'm calling the insurance company. I'm asking for the appeal. Did you send that over? I'm like, you guys should be paying me for this. I'm trying to follow all of your rules, which are obscure anyway, to get this done. So what I see is it's going to keep moving this way. We're seeing it already in the specialty cares, right? Direct primary care is leading the way, obviously. Healthshares are right behind. I'm seeing it in physical therapy offices, in chiropractic offices, and dentist offices. I'm seeing it in urgent care. The free medical market is coming up and giving people a different opportunity. And it's just those people who just, can see and think a different way, or the people who have had a terrible experience with how it is. So I think once this becomes more mainstream, and it will, you keep letting things operate the way that they are. And I think that these movers and shakers will come along with a different solution. Like, no, we do have freedom of speech. We do get to decide what we want, and we are going to choose our healthcare. And I want to receive healthcare. In my experience, the insurance companies have really just muddied the waters. Like, I don't understand what I'm getting. I have to check all these boxes and follow all these rules, and I'm paying a really high price to do so. And it's very confusing. It doesn't feel like healthcare to me. So I see it making a big wave and a big change, and I hope so. For us personally, for Zion Health, our mission has always been to become the standard health share. So when you think of health share, Zion Health should be one of the first things that you think of, and that should be how it should be designed and set up. And it's about putting the patient first. And I knew I came on board this company when it was just a little guy, and I've seen it grow, and everything has gone towards member care and member needs. We have a really robust member needs and member care team, and it took a long time for them to hire outside of that, and I was one of the first. And still, the growth has been organic. It's been, have you heard about us? Word of mouth, and it's just growing. It's growing fantastic, and it's making a difference. And it's now, been 4 years later, and I'm now getting conversations that's like, I've been watching you. I see you guys make a difference, and I want to be a part of what you're doing. So that's been my vision so far. I think it's, keep letting people do what they're doing, and there's going to be a response like there is.
Well, I love the word that you said, vision, right? Like, vision is so important with any company. And, the word Zion I has a special place in my heart, because I was actually baptized. My first church that I ever went to, I was baptized Lutheran, but I'm non-denominational now. But I went to Zion Lutheran Church in Mission Valley, Texas. So shout out to Zion Lutheran. Yeah, right. But I'm glad you brought the support team back up, because I wanted to just dive into that before we close out here. And, when you guys have a need that comes up, you guys call them needs, right? Because I know every HealthShare calls their, needs different things. But do you guys call it a needs coordinator or a needs analyzer? What do you guys call it?
So we actually have a member care team, which is kind of our base team that's going to take care of you when you call in. We have our needs team, which is going to take care of you when you need to use us for something large and unexpected. And we have our member advocacy team, who's going to take care of you with that coordination of care. Like I said, setting up the surgical centers, or making sure that your provider is paid their package, before you go in. If you need to see your doctor for a preventive visit or an urgent care visit, we're going to do what we can to pay at the time of service. So we have those different layers to our team. We also have a dedicated maternity team. These guys are fabulous. They take care of the moms all the way through. I'm not supposed to share with you, but we send them flowers after baby is born. They just do a really good job. We also have a dedicated log. Yeah. So it's been really fun to watch the growth. And like, as a need comes up, we need to really separate that out and take care of our moms. And we've built a team to do that. Fabulous, fabulous people back there.
I love that. I love that you said that, and I cut you off. So you have a dedicated care team for the needs. You have a dedicated care team for the maternity for the moms, which I think is beautiful. And you were about to say you have another dedicated team, because I think there was 3 layers. Isn't there another one? Or
long-term care.
Long-term care. Look at that. I think that is phenomenal. So you guys have, individuals and families, you have DPC, you have employers, and then on the needs side, you basically take care of all of the needs, for the most part. And then you have a maternity area and then a long-term care. I think that is a wonderful design, and I think Zion is really leading the way there, and that's why I wanted to have you on this podcast, because what most people don't understand about Healthshares, and this is where I think they get scared, is that, well, I go in as a cash pay patient. Well, now I don't have insurance, and they get scared about that. But what you guys have to think about that you're listening to this podcast is basically by you being a cash pay patient, you're saying, I am in control of what I'm getting and how I'm getting care. And then your needs coordinator, once you have those needs and once you have those hospital bills, I'm assuming, Heather, correct me if I'm wrong, but you upload those bills and then the needs member support team goes to work and starts to negotiate on your behalf, right?
Absolutely. So let's say you have a large medical need. Maybe I always use this example. Maybe you've broken your leg. It's pretty bad. It's a compound fracture. Let's say you need to go to the ER. At the ER, you're going to present as a self-pay patient. You're going to get all of your care done that you need. You'll probably have surgery. You'll have follow-up visits. You're going to have maybe physical therapy. It was quite bad. You're going to receive those bills right there at the ER for your services at that time. You'll have a personal responsibility. So for us, we're designed more of if you want to think of it as a deductible per incident, rather than a cumulative deductible where little bills will add up and then the plan will kick in after that. So we operate on a per incident deductible, if you will, or per incident IUA is what we call it, initial unshareable amount. So right there in the ER, you can either meet your IUA or you can set up payment arrangements with them, receive the itemized bill, take it back to Zion Health, upload them to our website. You'll open a needs, and then our needs team will reach out and work with you on the remainder of those bills. Once you've met your IUA, we're going to pay the providers directly on the remainder of those bills, up to physical therapy. If it crosses over a calendar year, doesn't matter. It's all part of that one need. So we really do have that team to step in and just help take care of you for the rest of your time with us.
Absolutely. And Heather, correct me if I'm wrong as well, but just one last little tidbit here. For folks that have pre-existing conditions, even if you have pre-existing conditions, say you have cancer, you guys still accept them as members, right? So if they break their leg, even though they had cancer, and maybe those won't be shared initially until the terms of the, sharing, guidelines that you guys have. But even though they had cancer and that's not shareable, if they break their arm or break their leg, that's still shareable, correct?
It is, yes.
Absolutely. So guys, don't let that scare you. You need to look into getting a Healthshare today. So Heather, as we close out, why don't you share with everybody how they can get in touch with you, how they can get in contact with Zion Health, and how they can start to change healthcare, as you said.
Absolutely. The first stop that I would suggest is to go to our website. Like you said, we try to be as open and as transparent as possible. It's simple. It's easy to look at. It's easy to use. If you still have questions, you can give our member care team a call, or you please reach out to me directly. I would love to have conversations with you and just answer your questions. You'll find that Zion Health always takes the approach of education. We let you know how we work, and then you get to decide if it's a good fit for you. So like I said, if you do have some pre-existing conditions, we do the education for you, then you get to decide if it's going to work for you or not. A lot of times that it will, but there are some instances where it won't. It makes more sense maybe to go find a catastrophic plan on the marketplace. But those are usually far and few between. And when you're an employer and you're talking to your employees, this is going to be part of that conversation. We're really good at handling those for you. We have a dedicated team that will help you with those presentations. You bring in your direct primary care and you bring in Zion Health. You add that to your employee offering, and it's just a win-win, and we can help you with every step of the way through enrollment. The nice part about us, too, is that we're not going to increase our prices next year, on your anniversary date based on your usage. It just stays the same month-to-month membership. It's a membership that belongs to each employee. They can take it with them when they go, which makes it even more valuable.
Absolutely. So, ladies and gentlemen, thank you so much, Heather, for joining us today. 40,000 members and growing rapidly, and you still have that white glove, give me a call approach. I absolutely love it. Thank you for being who you are. Thank you for being a part of Zion Health. Thank you, Zion Health, for continuing to lead the way to change healthcare. And thank you for your time today, Heather, on the podcast.
You're welcome. It was my pleasure. Anytime. It's always good to be part of something like this.
Absolutely. Well, ladies and gentlemen, that is going to do it for episode 9 of Direct Primary Care Benefits Podcast. I want to encourage you to share this podcast, tell your friends, tell your family, tell any employers that you know that are looking for better healthcare for their employees, because there is a better way to do healthcare, and we are on a mission, and that mission is to fix healthcare. So thank you so much for joining us. This is Brett Shoemaker, your host. Have a great day, and God bless. Until next time on Direct Primary Care Benefits Podcast. Have a great day, everybody.